Welcome to the Man Cave Podcast with Dan Casper.
Catching up with our good guy, Austin Bro. Happy New Year, Austin. How are you doing?
2026, doing great.
Absolutely, man. Well, I mean, maybe not if you're a lot of these Packers players that's going through a plethora of injuries and such. And, you know, I know we've kind of touched on this before, but you got a lot of Packers fans, at least on social media, saying injury prone, blaming doctors, blaming training staffs and all that. But I mean, you know, we've touched on that before. But when you see the amount of injuries a team like this goes through, whether it's like ACLs and Achilles, do you look at trends or is this just more, again, it's just bad luck and it's just a fluke kind of thing?
I mean, I think there's a handful of more fluke. I mean, you know, you look at like Micah Parsons' injury, for example. I mean, you know, quarterback's going one way, he's trying to go the other. That sudden change of direction in space, then he just gets put in a bad spot. I mean, you can't look at Micah Parsons back, well, that guy didn't train hard enough, or he wasn't, you know, his body wasn't in the right, you know, physical state. I mean, he is a specimen. So I think there's just some things that just happen. Tendon injuries, Achilles, those are things that maybe, you know, could have had a little bit of like, I don't know, like maybe we could have done a different stretching program or things like that. Because we do know that ruptured tendons like that do have likely an origin of like a tendonitis or chronic tendonitis that begins it. But even so, there really has been no evidence or studies that say, well, if you do this stretching program versus this, it really makes a difference. So there's no data to support it. So I would say it's chalk it up to bad luck. I mean, teams go through it in different spells. I think, you know, obviously this season you guys have had a lot of real serious ones. And then in addition, it's just also the timing too, right? You get into the playoffs and it's just you took your lumps right as you're entering that. So to me, I think it's a bit of the old bad luck.
Yeah. With Malik Willis, I want to go back to that game against Baltimore. So he got the start, and well, even the game before, it looked like he suffered a shoulder injury against Chicago, but he got the start, and then like close to the end of the fourth quarter, he throws the football, and then all of a sudden he just kind of crouches down and grabs his shoulder, runs to the locker room, comes back out on the field. Now, I had heard that it was an AC joint on his throwing shoulder. Did they kind of just maybe inject him with a painkiller, or how was he able to go out there and throw and then immediately come back out on the, you know, out of the locker room into the sideline?
That is one injury we will often do an injection into, yeah. So AC injuries, if they're lower grade, and I'm guessing on exam you can tell if it's a high grade. So a high grade AC separation or AC sprain, literally the clavicle pops up in the air. So you'll you know, at first assessment, you slide your hand across. In fact, you can visually see it often, but you'll slide your hand. You're like, okay, there's this big step off. So you know it's a high grade injury. Those you probably just say, look, we're going to shut it down. If it's a low grade injury, so you feel it, you may even, and they have access to this right there in the training room, is get an X-ray to say, look, it's not shifted, it hasn't moved at all. That means it's a low grade AC separation. Those are very safe to play with, but they hurt. So that's one of the few injuries where it's like we'll take and put a local anesthetic injection into the AC joint because the risk of further injury is very low. Now, you know, that's going to hurt like heck the next day, let me tell you, but it's able to get him back on the field, and that's one of a couple injuries that we will inject and get him back out there.
Yeah, interesting. So going back to Micah Parsons, I want to ask you this. So, you know, him and Patrick Mahomes tore their ACLs on the same day. Obviously, we've talked about this, and Patrick Mahomes had a little bit more than just his ACL, but Patrick Mahomes had surgery, I think it was the next day. Parsons just had his a few days ago. So why do you think the difference in timeline between the two? And because, you know, my mind thinking is like, we'll have the surgery right away so then you could come back quicker, you know, even though if it's just a couple of weeks. But why the difference in that, do you think?
Yeah, this one is a great question. So if we look at there's one very large distinguishing factor is the fact that Mahomes also had what's called the posterior outer corner injury, that LCL, the outer injury. When we do that part of the surgery, we have to dissect out what's called the perineal nerve. So it's a nerve that runs on the side of the leg, and it runs down, and it's what cocks your ankle up and cocks it out. So it runs to the anterior and the lateral compartments of your leg. If you delay, you know, several weeks, the injury out there, because if you get an MRI, there'll just be this like bunch of inflammation through that whole outer part of that knee, and basically like scar tissue and fibrosis sets in. So when you're the surgeon and you're dissecting that nerve out, which is and not the hardest part of the case, but it's probably the most dangerous as far as the patient's concerned, because if you injure that nerve, they have a foot drop. And as you might imagine, that hard to be a pro athlete with a foot drop. So, you have to dissect that out. You want to get to it soon. So does it have to literally be the next day? No. But if I see an athlete that comes in with an ACL and a post-op corner injury, I'm usually recommending surgery within a week to 10 days if I can, because it makes it easier for me and it decreases the risk of injury to that nerve. Now, conversely, if you don't have that, now you say, okay, what's our reason to go ahead quickly with surgery? Well, you're right. The sooner you do surgery, the sooner you recover. But we do know from several studies that if you get back into an ACL too quickly, if Micah, let's say, had really significant swelling and didn't have his range of motion yet, excessive stiffness going into surgery can run the risk of developing excessive stiffness afterwards. And so often we'll do a little bit of quote unquote prehab to get the leg moving. So we want them bending their knee, if they can, to like 110, 120 degrees of flexion. And so unless there's an injury that supersedes that, so let's say a locked meniscus tear, a large chunk of cartilage, or a post-op corner injury, those are things that we'll say, doesn't matter, we got to do surgery right away. If it's not, you want to say, okay, do we have the enough range of motion for us to recommend the reconstruction? So Micah may have just had a lot of swelling and stiffness, and they said, look, let's just give it a week or two to get that leg moving and get the knee bending better, and that's when they go ahead with it. So that was probably the difference in the two.
And so a lot of it is kind of the swelling portion of it, and that's what I was kind of wondering, and if that kind of altered that timeline and such. So does that kind of?
Yeah, it does.
Oh, go ahead.
Mm-hmm. No, I was gonna say for definitely for Mike, and then again on Mahomes is it's just the fact that injury when you're dissecting that nerve out. So there's a handful of things that will make us just say, look, let's do surgery and do it right away. But luckily, I mean, in Micah's circumstance, there was not one of those injuries. So then you have the ability to say, all right, let's get the leg optimized prior to surgery. So in other words, a week or two on the front end can save you months on the back end of stiffness and swelling you're trying to fight through. So you're really actually winning that battle, as much as it seems counterintuitive. If you get the leg optimized before, it can really help you on the back end.
So, okay, it's for somebody like me, then like when I see that, it's like, dude, why are you delaying your recovery process sort of thing? There's actually a rhyme and reason to it behind the scenes that us general fans don't quite understand or don't, know what's going on.
Exactly. So, like, again, the assumption is that his knee was very swollen and stiff. And if you do that surgery, he's probably going to have an extra couple months on the back end trying to fight through that. You pay the piper now, get it in better shape going into the surgery, and it just helps them jump right out of surgery and get going.
Gotcha. I don't know. Are you going to the game on Sunday with this preseason game, the preseason between Vikings and Packers? With some
geez, man. It's going to be the backup bowl.
Right. So that's what I was going to ask you. Have you heard anything about if McCarthy does start, or would you start him with that hand injury in that final game?
Yeah, so I've been looking at it. I haven't seen a definitive answer. I guess I'm going to the game. I think at this point as a Vikings fan, I want him out there. I mean, it's just been such an upside. He's had moments where you're like, all right, he looks okay. And then other ones you're like, oh my gosh, we're in rough shape here. We got bit by the injury bug really bad early in the season. There was 2 games where we played our entire offensive line, starting offensive line were backups. And one guy was the third string. So, I mean, we had some serious injuries, and right now I think we have at least one because Darrisaw is out, and I think one of our guards might be out as well. So I mean, we're down 2 O linemen, So it's like, are we really getting a good look? Because I mean, especially with a rookie quarterback, if you don't give them good protection, I mean, they need every advantage they can get. They don't need any disadvantages. So, I want to see him out there if I can. Now, of course, they call this hairline fracture, which means they probably only saw it in MRI, which might be a fancy way of saying like a severe bone contusion even. I mean, because it gets kind of, those non-displaced fractures you can't see in X-ray. Because if you remember, they first came out and said it wasn't anything. Then they later said, oh, there's a hairline fracture. So that means they probably picked up on it on an advanced image like a CT or an MRI. So it's probably stable and safe to play with. But, I'm in the camp of like, I want to see what he has. And, do I think we move on from him yet? No, but clearly there's a lot in the fan base that are ready to do that. And it's just the day and age of like, these quarterbacks are given about 2 games to mature and be all pro quarterback, right? It's just
right.
The leash is very short. And so, which you have to wonder does he need more? I mean, and you really look at some of the quarterbacks in the last 5 years that have had that like second wave of in their third, fourth, fifth year where they've all of a sudden become good. I think it's because they were probably good all along and they just didn't have a chance to develop and get in the right place, right system, mature. I mean, think about how complex it is to be an NFL quarterback, trying to make those reads, so you have to have the physical tools, which we all know about, but it's the mental aspect. So I realize it's a very long-winded answer. I want to see him play. I want to see what he has, and I want to see if we can have a little bit of a bright spot going into next year. But yeah, I don't think you're going to be able to draw many conclusions from this game just because it really is going to be a whole lot of backups out there.
Right. But no, you make a good point about the quarterbacks. I mean, you look at Sam Darnold's, the Baker Mayfields, guys who got second, third opportunities and taking advantage of it. And I agree. I think a lot of it is, getting those younger guys into the right system. And heck, maybe Malik Willis is probably going to earn himself a nice contract somewhere too. So it's, yeah.
Yeah, I mean, absolutely. There's all those guys who really have had, I mean, there's also a thing is like, if you think about it, who are the top quarterbacks getting drafted by? The worst teams.
Yep.
So they're going into situations where it's like, okay, you're already in a way set up for failure to a certain degree. But yeah, I mean, look at some of the really like top level Hall of Fame, like kids, when we were kids, the guys we looked up to, the best quarterbacks, if you look at their first couple of years of statistics, you're like, wow, they struggled. They did not. I mean, I think in today's day and age, especially with social media, those guys would have been crucified. I bet some of them wouldn't have played more than a couple of years. There goes a Hall of Fame career, right? So, but on the same token, there's busts, right? So it's like, how long do you stick with that guy and say, all right, season 2, 3, 4, at what point do you say, all right, we're in trouble here? So I mean, that's obviously the GM's job, and it's our job to yell at the TV, right?
Right, yeah. But, you think about Aikman was really bad. Peyton Manning, his rookie year, had more interceptions than touchdowns, for crying out loud. So, I mean, yeah. Think about what would have been, what they have, it might have been a whole lot different if social media, I agree, social media is just kind of crazy. Really quick, back to McCarthy, though. If he does play with that, quote, hairline fracture, is there any possibility that he could do further damage to it, especially with that banged up offensive line if he takes a couple hits? Although we don't have a pass rush anymore, so maybe that's okay. So
yeah, exactly. I would say the risk is low. You can never say zero, but I mean, he'll probably have like a little bit of a brace on it. They can make these like custom thermoplast, like little braces that would support it. You take a direct hit, it could, but I think the risk is going to be pretty low. So if they feel like he's able to physically grip a ball and throw it, I think the risk of further damage is going to be pretty darn low. And I'm guessing a lot of the GM and coaches are probably thinking the same thing we are, is like, we need to see what we have with McCarthy. And so my guess is they'd lean towards playing him if they can. But on the same token, if he can't grip a ball real well or if he can't throw it well, then he can't be out there. So I guess if he's able to do it, I think it's relatively safe.
Gotcha. Just a really quick couple more. Lamar Jackson said he's going to play. He missed one game, that Packers game, due to a back injury. And I know some of his teammates said after it was the game before the Packers when he suffered that back injury that he was in a lot of pain and couldn't move and such. So now you got Pittsburgh win and in coming up on Sunday night. What would be some of the concerns you would have if you were the team doc with Lamar Jackson going out there to play, just missing 1 week with what sounded like a pretty serious back injury?
Yeah, I mean, and so when they talk about those, it's likely going to be in the muscles around the back, as opposed to like a spinal injury of any sort. So even though we hear back and it kind of is like, I don't think it's a very serious injury as far as like how dangerous it would be. So I think they can be pretty cavalier about playing as long as he's able to physically do it. I mean, if people have a real significant back injury as far as the muscle is concerned, it can really limit people. I mean, they can like hardly stand up straight and walk. I mean, anyone out there who's had like a back that tweaks, the paraspinal muscles, it can be really, obviously it connects your upper body to your lower body, right? That's what your spine does. So if it's not functioning well, it can really limit your ability to play. So those are things where I'm sure he's getting, all sorts of therapy, ultrasound, massage, dry needling, you name it, in effort to kind of calm it down. But, I think if he's able to get back out there and play and it's kind of going in the right direction, it should hopefully do okay. And those are actually an injury that sometimes if you can get them warmed up, it can actually get feeling a little bit better. And then you just worry about getting it where like later in the game, if you take another shot, things like that, you'd be a little bit concerned. Because I think at one point, I think they had mentioned maybe it was a contusion as well. So again, from a direct blow.
Mm-hmm.
So that'd be something he's probably going to be wearing a flak jacket to protect that. So I'm guessing he'll be out there, and he's obviously a tough guy who wants to be there for his team.
And then last one, don't know if he's going to play in that game. He was a limited participant, but T.J. Watt coming back from that crazy lung issue from a few weeks ago. If he does play, what would be the biggest concern about him going out on that field with that, recovering from that injury?
Well, I mean, the obvious answer is going to be he recollapses the lung, right? So a collapsed lung is called a pneumothorax. Again, it's just such a crazy story. I mean, I think there has to be, again, some pre-existing issues in his lung, like a bleb, so it's like a little weak spot in the pleural lining of the lung where one of the dry needles just happened to poke one, or it's just coincidental. But I mean, it's such a fluke thing. But I would tell you, I mean, at this point, those kind of lung injuries, we would certainly defer to the medical doctors. He probably was seen by a general surgeon and then a pulmonologist. So as a team doctor, if I was a team doctor, I'd defer to those guys and say, hey, do we think his lung's ready? Those things do heal pretty dang quickly. Now, when we get people back from those, so when I was in residency, we were on the trauma service. People get in a car accident, they break a rib, get a collapsed lung, we put a chest tube in. Like, we get those people back doing things. They're not trying to go out and play an NFL football game. So I guess I don't have a ton of experience on how you'd get a guy back and how quickly. But if they feel like he's ready to go, again, those parts of our bodies heal really quickly and really well. And so I would think it would be safe for him to be out there if they're giving him the thumbs up from those guys. And then again, yeah, you take a hard hit and maybe it ruptures that spot again. Then air goes outside the lung, but inside the chest cavity, and that's what a pneumothorax is. So, they would have all the ability to treat him right away. So even if it did happen, it wouldn't be. I don't think it would be life-threatening. It obviously sounds really like life-threatening, but it's not like you get a collapsed lung and you die in the field or anything. So it's probably something that they're maybe able to say, all right, let's see how it goes. But yeah, I mean, I'm sure the team doctors are deferring to the medical staff on that one and saying, all right, what do you think we should do on this one? That was, I mean, of all the injuries we've talked about this year, that is definitely the biggest, like, what the heck? I mean, it's just a weird, atypical injury from a dry needling, which is just, I've literally sent probably thousands of patients for dry needling. I don't think I've had a single complication ever, let alone this weird collapsed lung situation. So yeah, it's a bit of a weird one.
Interesting. He's Dr. Austin Crowe, Chippewa Valley Orthopedics and Sports Medicine. Appreciate you hanging out with us this morning to kick off the new year, sir. So you have yourself a fun time at the game. I don't even want to make a prediction for the game because I just want us to stay healthy. That's all I want for this game.
I'm sure. I mean, it's like, how does Vegas handicap a game like this? So it's like, who's even going to be playing? Mm-hmm. Neither team really has much to play for except a little bit of pride. But yeah, it's this is one of those things like, as a Vikings fan, you almost want us to lose and then get a little bit better draft position. I don't know. I mean, it is what it is. But yeah, we'll out there and cheer and see how it goes.
Just give me a scouting report on Clayton Tune for our Packers backup quarterbacks. So that's who you get to watch. So, all right. Well, you have a good weekend, bud, and we'll catch up with you soon. Okay.
Absolutely. Take care.
You got it. There you go, Dr. Austin Crowe, Chippewa Valley Orthopedics and Sports Medicine.